interview. We're going to be focusing on what would be parts 2 and 3 of the interview. Part 1 is introductions, but you know each other. Now I'm going to be evaluating you with this rubric, right? Make sure to grammar and vocabulary, right? You have to mind that. Discourse management has to do with fluidity, so how fluid you are. Pronunciation, that explains itself. Interactive communication, in the parts that are group parts, remember to use vocabulary having to do with talking in a group or discussion. So what do you think? In my opinion, well, I don't agree, that sort of thing. That's what you're going to be doing. Any questions so far? Okay. Well, the first part that you have there, right? You have several pictures, and what you're going to be doing is comparing. You're going to be comparing the pictures that you have. Oops. No, sorry. Actually, it's this one. Okay. Okay, this one, right? You're going to be comparing the two sets of pictures. You have several questions here, right? The point of the exercise is not to ask each other the questions because I'm already giving you that. These are prompt questions. That is, that'll help you start speaking, right? So why don't you take a second to read over the questions, right? And I'm going to give you 2 minutes total as a group to talk about this. Okay. Any questions?
No.
Okay. Are we ready to record?
Yes.
Okay. Well, go ahead.
Okay. Well, I see that in the first picture there is it's in a hospital, and in both pictures there are babies, but maybe in the second one there's not as clean or with the better resource that might be for the babies.
Maybe what they're trying to show is that with lower resources you can make better things, because here the mom is in with her baby, but they have the resources, and in this one they actually are with their mothers.
I think that even when we don't have enough money, we can help the most people, and this is what shows the second picture, because even that it's not a clean place or whatever, they do their job, so I think it's good.
Also there's the nurses, because I think here they don't get paid, or at least they don't get a really.
Yeah, that's right with the interaction. But well, I don't know. I still think that maybe in the first picture is a better way to have I don't know, a better birth, like something like that.
Okay, where do you think these pictures were taken?
In a hospital where they pay for it, and here.
This one could be taken to Philippines or Mexico or Africa, and this one maybe in the United States.
Okay, very good. And finally, where would you prefer your baby to be taken care of?
The first one.
The first one.
Yeah, why?
It's really common that babies get stolen. Sorry. And
Okay, excellent. Let's move on to the next section. Now, this next section isn't so much comparing as trying to decide what the aim of these images is, and then deciding which one is the most effective, right? Now, for this, all of you have to kind of come to a consensus as an agreement of which one you think is the better one, right? So you're going to be talking about that. I'm going to give you 3 minutes for this part. Okay. Any questions? No? Okay, go ahead.
I think all the images in all the media are showing the same thing. They're like tumors and
Like, don't smoke, it's dangerous. Yeah, but I think that the ones that have more like impact is like this one, maybe this, because they show you how like blood and I don't know. I think it's like more had a more impact like this one.
I think this one is the one that has more impact because it's a real case. It's the name and what she said. But these ones, they're just making a big impact. So it's not working that well.
I think I choose this one because it's like a, I don't know, like if you smoke one cigarette, it's like what you're goes into you, and these two one, I think like they're like
Edited.
edited,
Mhm.
and I don't know why I don't feel like the the message, but
Mm,
but are
I
all
really kind of hate all this kind of propaganda because it's
Yes.
just like, if I want to smoke, I know what I'm doing, you know.
yeah, I think that they're well, it's still in the package of the cigarette. We still see the pictures and then we smoke. Well, people do it, but I think that we have to choose two pictures. So, what do what do you think?
I would choose this one, and I already said why.
I think I will say like this one.
the two.
Sure.
This
Uh-huh.
okay.
Any particular reason? There's others that are like more gory. For example, this one is blood. That one has fat. Why these two?
Because I don't like the blood. I think it's too.
Aggressive, no?
It's too
Yeah.
aggressive for you to look at blood and
I mean, I just want you that people know what is like they are smoking, no scare them.
but maybe if someone tell them to actually stop smoking and he gives you a reason that
It's more
actually
effective.
happened, it's
Okay. Very good. Okay, just a little bit of feedback. The thing I marked you down on, all of you, had to do with grammar and vocabulary. For example, Bao, you talked about better better resources, right,
Okay.
plural, right? And also you talked about the one that has the more impact. Remember when we're saying in English, in más, right? Superlative, it's the most impact. Same thing, Juan Pablo, you said the more impact. It should be the most impact. And also having to do with comparing, right? You said with the lesser resources. It's with less resources. Less is already comparative. You talked about steal and stolen, right? So also that. Bao, you tend to move the order of certain words in the sentence. So for example, you said, what shows this second picture? The best way to say it would be what the second picture shows. Other than that, very good. Good interactive communication, fluidity. So good job. Yeah. Okay. Any questions about anything?
No,
No. I will see you until
Monday.
Monday.
Monday. Yeah. See you on Monday. Take care.